As we age, the simple act of walking across the living room or rising from bed can be interrupted by sudden stabbing pain in the calves or thighs, nocturnal leg cramps that jolt us awake and leave muscles tight and tender for days. For many seniors, these involuntary contractions are more than a nuisance. They erode confidence in mobility, disrupt sleep, and herald declining muscle function. While hydration and gentle stretching are helpful first steps, mounting evidence shows that targeted nutrition can powerfully protect against cramps by repairing muscle fibers, stabilizing nerve signals, and balancing electrolytes. I'm Dr. Green, and in my decades of practice treating age-related muscle disorders, I've seen how dietary adjustments transform lives. Below, we'll explore the top 3 foods eggs, bananas, and nuts and seeds that deliver the precise blend of protein, vitamins, minerals, and healthy fats seniors need to keep leg cramps at bay. You'll learn the biological mechanisms, practical serving guidelines, and special considerations to restore comfortable, cramp-free nights and preserve robust mobility. Eggs, the complete, muscle-building and nerve-protecting powerhouse. Why seniors need high-quality protein as we grow older. Sarcopenia, gradual loss of skeletal muscle mass and strength accelerates vulnerability to fatigue, weakness, and cramps. Each of your body's 600 muscles depends on a constant supply of essential amino acids to rebuild microscopic damage from daily use and to maintain the fine balance of contraction and relaxation. Eggs shine here as a complete protein source, containing all 9 amino acids your body cannot synthesize. One large egg provides 6 grams of high biologic value protein, directly fueling muscle repair and reducing the risk of contraction-induced injury that sparks cramps. Vitamin D for calcium handling and contraction efficiency beyond protein. Egg supply. Vitamin D, a fat-soluble hormone, critical for intestinal calcium absorption and optimal muscle fiber function. Deficiencies in vitamin D lead to impaired calcium handling in the sarcoplasmic reticulum, precipitating muscle weakness and painful spasms. A single egg yolk delivers roughly 40 IU of vitamin D, which, while modest compared to the 800 to 1000 IU recommended for seniors, helps complement sun exposure and fortified dairy or fish intake to maintain serum 25-hydroxyvitamin D levels above 30 ngm L, essential threshold for neuromuscular health. Vitamin B, D, and choline. Guarding the neuromuscular junction. Effective muscle contraction demands flawless communication along the neuromuscular junction. Vitamin B/D is indispensable for myelin sheath integrity and neurotransmitter synthesis, while choline assists in age-related gastric atrophy and common medications compromise B absorption, elevating the risk of neuropathy-induced cramps. Eggs offer an easily digestible low-fat source of both nutrients, safeguarding nerve conduction velocity and preventing the misfires that trigger involuntary spasms. How to incorporate eggs safely. Frequency. Aim for 6 to 7 whole eggs per week for most seniors without advanced cardiovascular disease. If you have elevated LDL, consider substituting some yolks with egg whites to maintain protein intake, while reducing dietary cholesterol. Preparation tips. Boiled, poached, or lightly scrambled in olive oil preserves the nutrients without adding unhealthy trans fats. Pairings. Combine with leafy greens or whole grain toasts to boost fiber and micronutrient synergy, and avoid isolating eggs alongside high-fat processed meats. Optimal banana usage daily intake. 1 banana per day is sufficient for most seniors. Individuals with frequent nocturnal cramps may benefit from 2 bananas spaced between lunch and an hour before bedtime. Blood sugar considerations. Diabetic seniors should enjoy bananas alongside fiber, protein, 2 blunt glycemic spikes. Hydration partner. Bananas synergize with adequate fluids. Aim for 6 to 8 glasses of water daily to ensure electrolytes distribute evenly and support renal function. Nuts and seeds, micronutrient-dense, snacks for sustained muscle health, magnesium and potassium in concentrated form. Nuts and seeds deliver magnesium and potassium in just a small handful, making them potent allies against cramp-prone muscles. For example, food, potassium, magnesium, pumpkin seeds, 226,168 almonds, 277 pistachios, 290-34 cashews, 160-74 walnuts, 125-45 regular consumption. Replenishes electrolytes lost through sweat, diuretics, or simple aging processes. Healthy fats and anti-inflammatory benefits beyond minerals. Nuts and seeds provide omega-3 and fats that reduce oxidative stress and improve microcirculation to muscle tissue. Enhanced blood flow delivers oxygen and nutrients more efficiently, while dampening inflammation helps muscles recover swiftly after activity, further lowering spasm risk. Protein content for repair. Though not as rich in amino acids as eggs, many seeds contribute to your daily protein tally, supporting ongoing muscle fiber repair and reducing fatigue-related cramping. Practical guidelines. Portion control. Stick to 1 ounce per day to avoid excess calories and weight gain. Variety. Rotate between seeds and nuts to cover broad nutrient profiles. Presentation. sprinkle seeds on salads, blend nuts into smoothies, or enjoy them raw, unsalted as a midday snack. Complementary measures and cautionary notes: maintain adequate hydration. Even mild dehydration can concentrate electrolytes and precipitate cramps. Spread water intake throughout the day, and consider coconut water or electrolyte-enhanced beverages post-exercise or during hot weather. Medication review: many seniors take diuretics, proton pump inhibitors, or metformin medications that deplete potassium, magnesium, or B. Always discuss with your physician the need for supplementation or dietary adjustments to counteract these side effects. Underlying conditions: chronic kidney disease may demand protein and potassium moderation. Work closely with a nephrologist before increasing eggs or bananas. Hyperlipidemia: use egg whites in place of yolks and emphasize unsalted nuts to control cholesterol and sodium. Diabetes: monitor postprandial glucose. When adding fruits like bananas, pair with high fiber or protein foods to stabilize blood sugar. Imagine this: you're snuggled in bed, ready for sleep, but then bam, painful leg cramps strike. You might find yourself sitting up, stretching, massaging the affected area, desperately trying to relieve the discomfort. These nocturnal leg cramps, especially prevalent in older adults, can be a real nuisance, impacting sleep and overall quality of life. And if they're keeping you up at night, it's essential to know when it's time to seek professional help. But before we delve into those red flags, let's discuss what causes these cramps and why they become more common as we age. Leg cramps, particularly those occurring at night, are often linked to dehydration, electrolyte imbalances, and reduced blood flow to muscles. As we get older, factors like decreased kidney function, hormonal changes, and less physically active lifestyles can exacerbate these issues, leading to more frequent cramps. Now, while many seniors try to tough it out, hoping the cramps will just go away, there are instances where it's crucial to consult a doctor. So here are 5 scenarios where you shouldn't hesitate to seek medical advice. Number 1. When diet and lifestyle changes don't bring relief. When simple adjustments to your diet and routine, such as staying hydrated, increasing potassium intake, and stretching regularly, don't help, it's time to consider other factors that might be contributing to your cramps. This could involve looking at medication side effects, underlying health conditions, or other lifestyle habits that might be aggravating the problem. Number 2. Accompanied by muscle weakness. Muscle weakness, especially when it comes with leg cramps, could signal a problem with nerve function or even muscular degeneration. This is particularly concerning if you notice that you're losing strength and experiencing cramps simultaneously. It is essential to get this checked out, because it could be an early sign of something more serious. Now, swelling in the lower legs. Swelling in the lower legs or ankles, often referred to as edema, can accompany leg cramps and point towards a circulatory issue. Reduced blood flow due to conditions like peripheral artery disease or heart failure can lead to both cramps and swelling. If you observe persistent and unexplained swelling alongside your cramps, it's essential to seek medical evaluation. 4. Tingling or numbness. If you're experiencing leg cramps alongside unusual sensations like tingling or numbness, it could indicate a neurological problem. Conditions like peripheral neuropathy can cause these symptoms. It is important to address this promptly, as early intervention can often be more effective in managing such conditions. And no. 5. If cramps disrupt daily activities, while occasional leg cramps might seem like a minor annoyance, if they're significantly impacting your daily activities, it's time to take action. Persistent cramps can affect your mobility, balance, and overall quality of life. In such cases, seeking professional help can be invaluable in identifying the underlying causes and finding effective solutions. So if you recognize any of these signs in yourself or a loved one, don't hesitate to reach out to a healthcare provider. Early intervention and treatment can make all the difference in managing these issues effectively. Muscle cramps. Those sudden, involuntary muscle contractions can be uncomfortable and sometimes even painful. They are often characterized by a sensation of tightness or cramping followed by a reflex-like jerk of the affected muscle. But did you know that there is a simple yet highly effective remedy that you might already have in your kitchen? Eggs. Eggs, the nutritional powerhouses they are, offer a wealth of benefits from their high protein content to their rich supply of vitamins and minerals. But how do they tackle muscle cramps? Let's dig a little deeper. The protein content in eggs plays a crucial role in muscle health and repair. This is vital because muscle cramps can be a symptom of dehydration or electrolyte imbalance, both of which can affect muscle function. Electrolytes like calcium, magnesium, and potassium are essential for proper muscle contraction and relaxation. Eggs provide a good source of these electrolytes, helping to maintain the right balance necessary for optimal muscle function. Additionally, eggs are packed with vitamin D, which has been shown to play a role in preventing muscle cramps. Vitamin D's influence on calcium absorption and its connection to muscle function helps ensure that the muscles receive the necessary nutrients to contract and relax efficiently. Incorporating eggs into your daily meals can provide your body with the necessary tools to combat muscle cramps, whether it's scrambled eggs for breakfast or an egg-based salad for lunch. These versatile culinary delights can be a simple, yet effective way to support your muscle health and reduce the incidence of those pesky cramps. However, it's essential to remember that while eggs are a fantastic natural remedy for muscle cramps, they should be part of a balanced diet and a healthy lifestyle. If you're experiencing persistent or severe cramping, it's always best to consult a healthcare provider. They can help identify any underlying issues and guide you towards the best course of action. Bananas. Beyond their delicious taste and convenience, bananas offer a unique set of nutrients that can play a significant role in alleviating leg cramps. These yellow wonders are naturally rich in potassium, a key nutrient known for its ability to prevent and treat muscle cramps. Potassium helps maintain the fluid balance within muscle cells, ensuring they remain properly hydrated and are able to contract and relax effectively. This is particularly beneficial for older adults who might face a higher risk of cramps due to age-related changes in kidney function and electrolyte balance. Moreover, bananas contain vitamin C and beta-carotene, both of which are antioxidants play a crucial role in protecting cells from oxidative stress, which can contribute to inflammation and potentially worsen cramps. By incorporating bananas into your diet, you provide your body with natural sources of these essential nutrients, supporting not only your cardiovascular health, but also your muscle function and overall well-being. Whether enjoyed as a quick snack, blended into a smoothie, or used in various recipes, bananas offer a tasty and convenient way to boost your potassium intake and potentially reduce the occurrence of leg cramps. However, it's important to note that while bananas are a great natural remedy for leg cramps, they shouldn't replace a balanced diet and a healthy lifestyle. If you're experiencing frequent or severe cramping, it's always best to consult a healthcare provider to rule out any underlying medical conditions. Nuts and seeds. Nuts and seeds offer a plethora of health benefits and can be a valuable addition to your diet when dealing with leg cramps. These tiny nutritional powerhouses are loaded with magnesium, a key mineral that plays a significant role in muscle function. Magnesium helps relax muscles after contraction, making it an effective aid in preventing cramps. Additionally, nuts and seeds provide healthy fats, which are essential for maintaining healthy cell membranes and ensuring proper nerve function. Nerves send signals to muscles, and any disruption in their function can lead to cramping. By including a handful of nuts and seeds in your daily diet, you provide your body with the necessary nutrients to support both muscle and nerve health. Some excellent options include almonds, walnuts, chia seeds, and flax seeds. These can be easily added to smoothies, yogurt, or enjoyed as a midday snack. Incorporating these nutrient-dense foods can be a simple yet effective strategy in reducing the occurrence of leg cramps and supporting overall well-being. However, it's important to consume nuts and seeds in moderation due to their calorie density. A small handful should suffice, and it's advisable to avoid salted or processed varieties to reap the full benefits. As you continue to explore ways to alleviate your leg cramps, consider consulting with a healthcare provider or a nutritionist who can offer personalized advice based on your individual needs and medical history. They can assist in creating a comprehensive plan that includes dietary modifications, lifestyle changes, and if necessary, medications to manage your cramps effectively. Remember, while natural remedies like eggs, bananas, and nuts and seeds can be beneficial, they're not a substitute for professional medical advice and treatment. Nocturnal leg cramps, particularly prevalent among seniors, can be a distressing experience, affecting sleep and overall well. While some might brush off these cramps as an inevitable part of aging, the truth is they are a signal that something is off balance, whether it's hydration, electrolyte levels, or blood flow to the muscles. By understanding the common causes and implementing simple strategies, you can significantly reduce the frequency and severity of these cramps. Incorporating eggs, bananas, and a handful of nuts and seeds daily provides a natural, easy way to bolster your body's defenses against cramps. These foods offer a potent combination of protein, vitamins D and B12, potassium, magnesium, and healthy fats, all essential for maintaining strong muscles, healthy nerves, and balanced electrolytes. While diet plays a pivotal role, it's equally important to stay hydrated, stretch regularly, and be mindful of medications and underlying health conditions. If cramps persist, don't hesitate to seek professional help. Remember, persistent cramps aren't just a nuisance. They're a call for attention, urging you to make positive changes for better sleep and overall health. Your body deserves the best, so nourish it with care and watch it respond. Restful nights and healthier days are within reach. Thank you for watching this video. If you found it informative, please give it a thumbs up and subscribe for more valuable content. Stay healthy and keep moving towards a better, brighter you.